influenza, we have control measures, reporting cases to the local health authority, and to assess the disease surveillance, we have to report outbreaks and lab confirmed cases. Isolation of cases of influenza is not practical because delay in diagnosis. The disease has been already transmitted during the incubation period. Ideally, all hospitalized cases with flu-like illness or respiratory illness, including the suspected influenza, should be placed in a single room. And this is one of the control measures for airborne isolation. One of the airborne precautions. Concurrent and terminal disinfection, treatment as stated before, and we have measures directed to the contacts, which include observation of the contacts for the longest incubation period, and prophylaxis using antiviral drugs may be also considered. This is the airborne precautions for any respiratory illness, including the influenza. The patient should be kept in a private room under negative pressure, and the door should be closed. The families and visitors should be stopped for visiting and report to the staff before entering. Clean hands before entering and when leaving the room is very effective precaution. And what about the staff? The staff is required to point of care risk assessment and always remember wearing the effective and protective respirator or mask, which is N95, N95. What about the epidemic measures? The response to influenza epidemic is planned at the national level, not the international one. And measures undertaken during epidemic of influenza are the following. First is the public health education, addressing principles of reducing the spread of respiratory tract infection. Very important during the public health education to maintain good personal and environmental hygiene all the time. Perform hand hygiene frequently. Cover the mouth and the nose with tissue paper when sneezing, coughing, or even talking, and then wash hands thoroughly. Wash hand with liquid soap and water and rub for at least 30 seconds. And then if you have fever or any respiratory symptom, you have to wear the surgical mask and seek medical advice promptly. This is a message during the public health education. Also, surveillance by health authorities for progress of the outbreak or the epidemic and communicating the finding to the population. Very important, if there is no available vaccine against the circulating strain, we have to maintain a continuous supply of the antiviral drugs for treatment of the high risk group of the population, including the medical personnel. All healthcare workers likely to be affected during the epidemic of influenza as a result of higher exposure to cases attending the healthcare facilities. Therefore, their immunization against the circulating strain is crucial during the initial wave of the epidemic to meet the increasing demands on the healthcare.